not solutions, but there's medications for now that they don't think it's as big of a deal to contract HIV?
That might be entirely possible. However, it is a big deal, and because we have medications, why it's more of a big deal, because it can be treated. In our practice specifically, we would like to reach out to the women that are pregnant, going to be pregnant, because these medications can prevent transmission to the newborn and neonate. So it's very important for early detection.
Let's talk a little bit about, so why do you believe that, or tell us why minorities are, I guess, more likely to contract HIV?
I think it's just a matter of a lack of education. People think simply that it's not going to happen to them, it's impossible to happen, or it's not going to happen on a one-time encounter, but these things do. And if they're not using condoms every time they have intercourse, these things can happen. And I think it's just simply just denial more than anything.
Have you seen just some heartbreaking cases in your practice that you can talk about in general of just, I don't know, any cases at all that people just didn't think that they had it, or they didn't want to know that they have it, or?
Yes, I can think of one couple specifically that is currently pregnant right now, and she is positive for HIV. And unfortunately, she's also late in pregnancy, where the medication, even if you start it now very soon, won't be as effective. So now the baby has to be tested and watch for HIV, and it's very possible the baby can contract AIDS from that. So that really could have been prevented earlier and easily if had it been earlier testing. One can't, it's so simple in the basic prenatal profile. When everybody comes in for pregnancy, you can get blood drawn very easily to find out the results of the test. And it's a shame that things are delayed, that now it becomes too late to be as effective. Mm-hmm. And that is a shame, because it is easily preventable.
Yeah. The future, I do think that, okay, so do you think that we live in an interesting community just because there are so many people that come in, tour, and then, obviously what happens in Vegas stays in Vegas, but not STDs and not HIV, like, that stays
Mm-hmm.
with you long term.
That's
so
true.
Do you think that you, as your practice has unique issues because of where we live?
Yes, I think it's true. You bring up the visitor issue, which is very true. There's a lot of partying going on in this town. Of course, this town is known for that, and has been for years, which is a lot of fun. But unfortunately, the bartenders do not serve condoms with the drinks, and they almost should. So yeah, and you're very right. Some things do not stay in Vegas, and that is STDs. They will be brought home to whatever country or state that you visited from, and then in your next partner. So this is a unique situation. We have all ages of people coming and going, and we have a very nice young population here. But they are partiers, and they could be nice, but also can be dangerous if it is not also taken care of.
I think sometimes people forget. We had like the Ebola crisis, and people forget because it's not super old. Like, we don't know a ton of still about this because we don't have a cure. But I think people see what they see as a healthy person, and they think, oh, well, I know, you're fine. You don't have an STD. I can't. Your eyes look healthy. You're fine. But you can still be HIV positive.
Yes, you can. There's no outward symptoms for many years, and so unless we could get blood testing, then we don't know that. None of us would know that without a blood test. It's a simple blood test and very definitive, but at the same time it has to be tested in the blood. And symptoms, of course, will not show for many, many years possibly. Unlike Ebola, it could be a crisis more immediately, and you can die from that, of course, but you can still die from AIDS, and that's a longer and more very torturous process.
Yeah.
But again, could be prevented.
Right. Those are really the only questions that I had. Is there anything else